Check, check, check. Hey, Shell. All right. Good deal. Hang on 1 second. Can you hear me okay? All right, good deal. Sounds good. This is a Marantz, and I'm using a Focusrite DAC. Thanks. Yeah, I appreciate the opportunity. Okay, I put the files in the chat. I'm going to need to present. Check, check, check. Should sound a little less muffled, and okay, we're good for on the air. Yeah, ma'am. Oh, wow. I'm just checking the stream. Make sure everything looks normal. Okay, it looks like the sound is coming through, so let me check that out. I've got a program for it. Yeah, it's streaming. It's streaming the sound. I'll go ahead and pull up the. There we go. Hey, Carol.
Yes? Carol needs to unmute. Okay, Zoom user. Hi, Carol.
Yeah, I'm going to be in transit, just to give you the heads up. So I'm going to have my camera off.
Is that Dr.
Okay.
Joseph?
Yeah.
Okay, right on. Hey, man.
Oh. Yeah, I'm glad you're doing this talk. I've been wanting to really dig deep and hear, hear what you got to say.
I appreciate the opportunity to be able to present. 100%.
Yeah, and we need it from somebody who's been through it, and we can learn from all angles, because as far as I know, most of the doctors still don't know what to do.
Correct. That's very true.
Right, and we got to get a patient. I think they're getting tired of hearing me complaining, and maybe they'll realize that they have Lyme too. They just don't know it.
That's very common. Very common to have Lyme disease and just either not know that you have it or to talk yourself into believing that you don't.
Yeah, yeah, exactly. Yeah, I've become pretty good at over the years and making people uncomfortable and showing me the evidence. How do you know?
Yeah, exactly. If the tests aren't reliable and you have this terrible debilitation that just continues to progress and the doctors are at a loss for what to do, I mean, maybe it's time to look at the potential that it could be Lyme disease. Not anybody saying that that's what it is for sure, but don't rule it out yourself without having a professional look at it for you.
Yeah, absolutely. And it could be the case that, at least from my experience, that, you know, there's a possibility that this is actually in everybody. Okay. If this is what I think it is, or a part of the same phenomena that we see under the microscope as, something that it may not look like what people think, imagine it. I'm sure they just imagine it's just some, bacilli with its tail is spiraling around and hiding. But what if it looks a lot different, or presents a lot different than people think? That's a case of seeing can be very valuable versus imagining. What if Lyme is part of, or composes, basically the spectrum of atypical medical mysteries that have been, that the population in general has been inflicted with, those presenting differently, for the past 30 years. What if Lyme just isn't what people think it is? Maybe it's more than just, I went deer hunting and got bit by a tick, and I had a bullseye rash and a ballooning knee.
Yeah, because that's the thing about imitator class infections is that they can imitate a myriad of debilitations, and that's what typically gets professionals, practitioners off. Is they're looking at depression and they go, okay, depression, we just got to refer out to psych, and then that may actually help this patient. They're not thinking neuroinflammation from a chronic bacterial brain infection. But with the resources that are becoming available in the following years and have already been starting to trickle in from appropriations to the Department of Defense, the CDC, NIH, this is going to become more prevalent, and doctors are going to get the training that they deserve so that they can keep a good rapport with their patient and not leave that individual feeling like they were left to fall through the cracks.
Well, yeah. At this point, there's no excuses. Well, the problem is obviously is the confusion with the literature, what the literature says, and what we're seeing, and being able to accept that there's other forces working that make or take away clarity. It keeps things wishy-washy, gray, and I really can't think of anything more damaging than to be the authority. Who else are you going to go to? You know what I mean? I mean, when somebody's scared, and they typically aren't going to the doctor unless, or any practitioner, unless they're desperate. Yep. And to be told, it's all in your head, just a basic one. It's is demeaning. It's degrading, and it without explanation. Put it like this. Based on what I've seen, depression is, like you said, it's neuroinflammation, and we have tests that can show show that inflammation. In fact, we have tests that can show antibodies to the various neural pathways that would explain the depression. That there's a lack of neurochemicals, or there's no the adrenals aren't producing anything. Very little. You can't have a positive attitude and override a physiological phenomena like that. If it's like trying to make a car drive with no gasoline.
Right.
I mean, it's just not going to happen. And it's usually the people who don't have it that tell you, that you need to, you know, you need cognitive therapy, or you need this, or you need that. But if they haven't been through it, there's no way. There's no shame in saying, I can't truly relate to what you're going through, because I haven't gone through it. I'm sure you wouldn't be here unless you, especially in this day and age, unless you've exhausted the available research out there. And there's a lot out there. I mean, you don't have to go through 12 years of misery in medical training in order to be able to put two and two together.
Right.
And I think just the best way to communicate on both ends of the spectrum is just to say it exactly how you see it. Look, I've treated a lot of things. I don't understand why certain people seem to have these confusing symptoms. I don't know. I think it could be this, but I just haven't gone down that rabbit hole. Or on the other end, how about this? No, I didn't go through 12 years of misery through medical training. I've read a lot of articles. I talked to a lot of friends. I talked to somebody who sounds like he knows what he's talking about. I read a great article and I had an epiphany, but I don't speak the laboratory lingo. Am I on the right track? You know what I mean?
Yeah, no, definitely you're on the right track. I mean,
No. I mean, I'm saying that that it's communication on both ends. It's like, here's where I'm at. Here's what I understand. Um, am I thinking in the right direction? If I'm talking to somebody who might have the answer, it's there's a lot of miscommunication. More so, I'm going to say on the medical end, because it's like a parent, uh, has to take more responsibility, in a dynamic where somebody's dependent. So anyways, I'm just rambling about all the different things that come to mind when I think about this subject.
It's definitely a nuanced topic, and there's a lot that not just the medical professionals, but the population in general aren't really considering. I've talked to doctors who have difficulty seeing Lyme disease patients, or patients who believe they have a specific kind of infection. It's not so much, hey, can you help me rule this out so we can make sure I don't have it? With some people, it's, I know I've got this, and I know this is the treatment, and you'd better prescribe it for me. And those are the kind of interactions that, we want to teach patients that there's a better way to have a more positive experience where you won't get let down, where you don't take a bunch of medications that ultimately don't address the issue, and that leaves you feeling further disappointed. We want people to feel comfortable engaging with their doctors on this topic and other topics that relate to it, like parasitic infections and fungal exposures and mold. And these are topics that doctors historically have been taught they're not really a serious issue. They're kind of marginalized. But now they're starting to come to the forefront, and people are realizing that not only is there, an epidemic of these misunderstood afflictions, but there's also a market for it. And that's where I think that for the anti-aging doctors and the ILADS, who my doctor is a part of, International Lyme and Associated Diseases Society, and even the IDSA doctors, we can all get together and set a path to better approach this topic when somebody comes in with a mystery illness. Everybody wants it. They don't want to have any more bad experiences, either with their patients or with their doctors. And I think we're on the precipice of evolving to the next paradigm where, okay, people are finally, in general, happy seeing their doctors again with these misunderstood debilitations. I think 10 to 20% is the figure of people who experience treatment resistance, and those often result in these hard to treat cases. 80 to 90% of people in general are happy with their doctors, but those aren't the people that we see at the end of the day who are struggling, who are desperate, and who have the potential to harm themselves, trying to do something that they believe might give them a chance to end the suffering. So we want to be able to up the game with our doctors. We want to do a better job of educating the public so they know what to expect.
Yeah, absolutely. It dawned on me that, at least from the practitioner side of things, it's important to realize that people who have these conditions, they've had them for years, most likely, and they've seen other practitioners. In fact, many of them I come across have traveled to, almost, it became their life journey, traveling to different places, trying to get answers and solutions. And so, you don't want to get caught into the trap of, this person just the patient's nodding their heads because they're like, yep, I've heard this before. Yep, he doesn't get it, shouldn't get it. You can't, there's nowhere to hide. That's the way I say it. You know what you know. And I like to think that it's okay to be transparent with what you don't know. And you know and hopefully it it should be, in my opinion, the best patient relationships are where they also want to have clarity. Okay. And if I can bring clarity, at least to the level that I understand it, that brings them to another level of clarity, then there's a much more solid um, connection. Compliance isn't really an issue at all. It's not a doctor dictatorship. This isn't the 1970s, the 1960s, or you know, uh, that's a different time, and maybe there's a time for that, where you you trust you want to trust whoever you're going to in general. Somebody, if you go to a shaman, you're trusting that they know what they're doing. They've got the magic herbs and the connection to the spiritual world, and they're gonna take you in that direction, a direction you cannot necessarily do yourself. I mean, that's just common sense. But carrying the old um, doctor dictatorship, in my experience, because I hear it all the time, is it's awkward. It's not fitting, and it's excluding that patients are intelligent in their own way, and although they haven't spent years of learning this stuff, in many ways they have an advantage because they haven't been led down the wrong road, or they don't have to relearn,
Yep.
which is often the case. well, really, it seems like the more majority of cases, situations, there's a lot of unlearning that has to happen in order to, again, what matters to me is truth. That's it. And, and giving somebody the degree of certainty of how much I believe something to be the truth. And, usually truth is, when something reaches the stage of truth, it it seems to be quite obvious. Like something staring at you right in front of your face, you just couldn't see it. But now you see it. Done. Yeah, I try to bring that level of clarity, the the big aha, you know. And then when the patients, when they bring up the things that they're asking about, instead of blowing them off, oh no, that's not proven and blah blah blah. You know, realize where you were at that stage when they were considering that. That's usually the case. It's like, oh, I know exactly what you're saying. I know what you're thinking. I know where you're at. If the doctor actually has figured it out, and be able to say, I'm here, I'm going to bridge the gap. There's a couple missing components because I had to figure that out too. Once I had these three things figured out, bingo. But I guess what's more important tonight is that we actually learn, Jeremy, about what you've learned and the journey you've been on, which I think has been, from my end, has been a long journey, not a pleasant journey. And certainly you've figured a few things out that most people don't know. So I'd like to hear what you have to say.
Well, yeah, I appreciate us having this discussion before my presentation, because I was actually revising my resources page while we were talking. You gave me so many ideas of things that I should have included that I just didn't get a chance to fit in earlier. So thank you.
Oh, okay. Thanks.
This is going to be a good one. We're going to talk about a lot of good topics. We're going to show some pictures of Morgellons, characteristics. We're going to take a look at biofilms. We're going to take a look at ticks. We got a whole world of things to go through. I'm going to ask, first of all, I want to thank everybody for tuning in, especially the people who are here live in the stream and Zoom with us. For those of you who are watching on YouTube, definitely appreciate y'all making the time in your evening to join us here today. If you'd like to drop some questions in the chat, that's available for subscribers. If you're new to subscribing, you're going to have to wait 20 minutes before it's going to let you leave a comment in there. We're going to start, and I would ask everybody to just hold your questions. We are going to do about an hour-long Q&A at the end of my presentation. So write them down, definitely, and I'll be happy to address. I'll stay late, and we'll get everybody's questions out of the way. So, good evening, everyone. Thank you for joining me tonight to discuss Lyme disease and what both patients and doctors truly need to know. My name is Jeremy Murphree. I'm from Greenville, South Carolina. I'm a Lyme and Morgellons patient, a web designer. My business is The Web Doctor. We'll be in business 20 years next June. I'm the host of Morgellons Discussion and Microscopy videos on YouTube, and Morgellons Discussion, the podcast. I'm also the founder of the new Morgellons Movement. We're a nonprofit, not a 501, but just a nonprofit here in South Carolina. We produce educational resources for Morgellons patients and doctors so that they can better understand our rare skin condition. I've shared my journey in interviews. I was recently interviewed by Justin Begay for an upcoming Morgellons book that's published by a university professor. And I've testified before the South Carolina State Committee on Lyme disease awareness and for medical marijuana. Tonight we're going to cover the Lyme basics, my personal story to illustrate real-world challenges, key takeaways for patients and doctors, and a focused look at Morgellons. Like I said, I'll be taking all questions during the end. First, I want to get out a few acknowledgements and make sure people understand. First and foremost, thank you, Shel Stein, for inviting me here to do this tonight. This is a rare opportunity, and I'm privileged to be able to
You're
present.
most welcome.
Thank you. Next, a warm welcome and introduction to Dr. Halasa and Dr. Joseph, who we've heard from just a few moments ago, from the Chronic Disease Prevention Management Group. Their expertise in managing and preventing chronic conditions like Lyme disease is invaluable, and I'm honored to have them here sharing insights and supporting our conversation. Thank you both for joining us and for your dedication to improving patient outcomes in this challenging field. Finally, I'd also like to extend my deepest gratitude to Carol Peterson, Dr. Klatz, and Dr. Goldman. Your belief in my story and advocacy work has been transformative. Thank you for affording me this opportunity to speak tonight. It's because of champions like you that voices like mine can reach those who need them the most. According to the CDC, around 476,000 people are diagnosed and treated for Lyme disease each year in the United States. But countless more suffer from misdiagnosis or chronic symptoms that disrupt lives. My own experience shows just how insidious this can be. Let's dive into my journey, which started much earlier than I realized. When I was a kid, we used to go to my grandparents' house, and they had a huge pasture in the backyard. The houses were very far apart. This was in Pelzer, and they had just built this street in this rural part of South Carolina, just outside of Piedmont. And just about every night when we went out there, we'd come back and Grandma would end up pulling ticks off of us. They'd be on our arms, our legs, sometimes embedded in our heads. My little brother and I. And at one point I developed a vertigo. I was about 8 years old, and everything was just spinning. It was the first time I'd ever experienced anything like that without actually, spinning around to make it happen. I could just lay down, and then everything went spinny. My grandparents were concerned at that point that maybe I had been exposed to Lyme disease. So they called the local hospital, which was in Anderson. And the attendants who responded to my grandmother's and grandfather's phone call said, "Don't worry about Lyme disease. That's not here in South Carolina." And so that was an opportunity for treatment that was missed. Maybe I caught something, maybe I didn't. There's a lot of reasons people can experience vertigo, but it did coincide with a recent tick bite. I applaud my grandparents for seeing the concern, the potential danger, and it's not the attendants at the hospital's fault that was their perception at the time, because that's the official narrative most of the time. So, fast forward a few years, maybe about 15 or 20, and I started developing little sores on my arms and legs. And I just remember thinking, wow, those look kind of weird. And there must be something inside my body that's causing that. So I would do the responsible thing. This was about 2004, 2005. And I'd go to see a doctor. Well, one time I went to see a doctor, and he said, "That is impetigo." And he showed me a picture of the impetigo, and I had to agree. I was like, wow, that's pretty intense. And so he said, "Look, the treatment is the same as the treatment for syphilis." And I said, "Whoa, I don't think I have all that." And he said, well, it's just coincidental, but it's the same treatment. You're going to get 3 shots, 1 week apart, and then that should take care of everything. No worries. So I did the treatment, and a couple months later it came back with the sores, and I was disappointed. And the doctor, he seemed shocked. He was like, wow, I can't believe that. He's like, well, what are you saying? Are you not happy with my treatment? And I just thought about that for a second, and I said, well, it just wasn't effective. And at that point, I started bouncing from doctor to doctor, maybe every few months. And the treatment was always the same. I'd come in with these ever-worsening sores on my arms and legs and face, and they'd always give me 2 weeks of antibiotics, typically amoxicillin. They may give me an injection of like Rocephin or ceftriaxone, and they'd give me the pyramid of steroids, prednisone. I did that for several years until I hit a point in 2014 where I was losing clients with my web design business. I couldn't focus or concentrate, and the sores on my skin had gotten so bad that they were literally oozing down my back, and I didn't know what to do. The fatigue was so bad I couldn't get up off the floor, and I just didn't know how I was going to get out of this. And I didn't think that expanding bullseye-looking rash that I had gotten in 2010 on the back of my thigh could have anything to do with it, because I didn't see a tick attached. I looked back there, I saw it, and I thought, man, that's weird. Well, there's no tick, so there shouldn't be any problems. I wasn't even thinking about Lyme disease. I was just thinking about getting sick. In 2014, I got so debilitated. I was losing clients, losing money. I had to move back in with my mom. And the thing that was most concerning was the progression of my illness. I was experiencing palmar rash. I was experiencing rash on my trunk. I couldn't sleep at night. And so I went to a clinic that was right down the street. They were one of those walk-in a la carte services, typically for preventative medicine. And it was the same thing. They said, wow, that looks like you got an infection. And so we'll try some antibiotics. And I took some antibiotics, and at the very least, it helped to get me a little bit better. And when I say they gave me antibiotics, it was more than 2 weeks. They said, well, let's just keep going and see how things go since you're doing better. And I was very appreciative of that. I was still very sick, but at least at that point I was getting antibiotics consistently, which could have or did have a healing, if not a curative effect. It didn't bring me quite to the point of functionality that I was hoping for, but it did get me one step up the ladder there. That was in 2014 after moving in with my mom. And there was one time when I was in the clinic and the doctor brought in a therapist to run me through an examination, a psychological evaluation. And I remembered, because I've always had this problem up until recently, and we'll get there. When somebody would mention something like politically divisive, and I would get emotionally involved in the discussion, oh, that guy stinks. I hate what they're doing. This is craziness. And it just wasn't any thought before all that came out. It was very impulsive. It was very agitative. And definitely not cooperative. And after that therapist left, and I thought about it for a second, I thought, man, I could have done a lot better in that. And I'd been doing things to try to get my point to where I could cooperate better with people, to where I didn't have this low-lying level of aggression all the time. And so I'd do things like green tea, and that really helped a lot. But it wasn't the answer. It wasn't making my skin better. I wasn't sleeping any better. I needed to do something. In 2016, I was doing some volunteer work for the Charles Holman Foundation, and that's where I initially heard about Morgellons. Morgellons is a rare skin condition that occurs in about 6% of Lyme disease patients. Through them, I was introduced to Dr. Ebony Cornish. Dr. Cornish works with the International Lyme and Associated Diseases Society. She's on the board. And I decided, based on what she was saying at her presentation, that that was the doctor I wanted to go with to try to get out of this mess. And so I booked a flight, borrowed some money, and went up there to Virginia, which is about 3 states up, 2 or 3 states over. I'm in South Carolina to see Dr. Ebony Cornish. This was the turning point. Through the Charles Holman Foundation, I was able to associate the potential that my skin condition, which is only verifiable with a microscope of 60 times or greater directly in the skin, that skin infection was likely associated with Lyme disease or a similar infection. That became a realized potential when her therapy for the first time in my life actually made a noticeable and measurable improvement. Specifically, I had always been apprehensive about taking antibiotics long term. I heard the horror stories. They'll kill you. They'll make your gut explode, you know. But at this point, I was desperate. And there were a couple things I did that I shouldn't have done, that were not safe. And this was something that was under a doctor's care. And if the doctor said, you need to take a combination of antibiotics, that could probably help, then I thought, okay, this can't be as bad as some of the crazy things people were suggesting that I do in these Facebook groups. And when she put me on the combination of 3 different kinds of antibiotics, that low-lying level of aggression completely dissipated. I felt like I wanted to be social. I wanted to be around people. I was 40 years old, and I felt cheated. Because for the first time in my life, I felt healthy and normal. I wasn't angry. I was finally starting to be able to get some sleep. And things were starting to improve. But she knew, based on the test that she ran, that I for sure had an infection, and that infection is called tick-borne relapsing fever, which is a Borrelia bacteria similar to, but not the same as Lyme disease. She knew what co-infections I was potentially dealing with and my clinical history. So she could factor in everything all together, my genetic report, and determine what is the best safe treatment for Jeremy specifically. And that made a difference. I had never, at that point, I was like, wait a minute. I've been going from doctor to doctor to doctor to doctor to doctor to doctor. Antibiotics and the prednisone over and over and over and over again. Why couldn't I get the treatment that I just got from Dr. Cornish from the past 30 doctors? Because if I had, I probably wouldn't have been losing clients, not making bad decisions, and not trying to self-medicate with crazy stuff like alcohol. And so a lot of times people come up to me because they realize, oh, wow, whatever Jeremy's doing, it must be working because he doesn't have the sores on his face or his arms. And they'll want me to give them the formula. What is it that Dr. Cornish prescribed to you that's working? And I don't give them that information because what worked for me may not work for anybody else, and it could actually hurt somebody. What I try to do is to direct people to go see a doctor who also specializes in functionality and in Lyme disease and these tick infections. And they may have to pay a little bit out of pocket for the visit. But insurance, and I've got Obamacare, it's covering my medications and my lab work. And that's, this is the first time for the past 8 years, 9 years since I've been seeing, 8 years since I've been seeing Dr. Cornish, this is the most stable my health has ever been. Physically, emotionally, and cognitively, I'm where I should have been for the first 40 years of my life. One thing I really want to touch on is the CBD. I'd mentioned earlier that the aggression was too much. I mean, I was just praying. I was like, God, take this aggression away from me. And CBD gave me the answer for that. I still take green tea, and I take other supplements like Japanese knotweed my doctor knows about and recommended I take. But CBD is a different animal because it complements an entire system in our body that doctors are not trained across the board to understand, the endocannabinoid system. CBD is undergoing clinical trials right now in the UK to determine if it can be an effective antipsychotic medication. When people take CBD for the first time, they go, Jeremy, I don't feel high. What is it's not doing anything. I just feel normal. And that's the point. The normal. Because when you're normal, you can plan, you can work, you can concentrate, you can focus. You're not impulsive. You think about things before you're going to go out there and do them. CBD did this for me, and it still does it today. And I think along with getting the right treatment from Dr. Cornish, the CBD is like, 45% of my remission recovery. Lyme disease, when it propagates into the brain, it starts causing behavioral disorders. And that's one of the reasons why Lyme disease gets misdiagnosed. Lyme disease is in every state in the country. That's a fact. It's not in every state equally in the amounts and the distribution, but there are different strains of Lyme disease all across the country. In South Carolina, where I'm at, we have Borrelia carolinensis, and that's included in the references sheet that I put in the chat. If you don't have a strain of Lyme disease prevalent in your state, you probably have a prevalence of other tick-borne infections, like potentially tick-borne relapsing fever. So overall, understanding the problem, being able to link it to Lyme disease potentially, getting a doctor who specializes in Lyme disease so I could get that ruled out, confirming that I have we don't know if I don't have Lyme disease because no test is 100% reliable, but it's looking like the infection that I got, that we do have evidence for antibody production, is tick-borne relapsing fever, which research has also associated with Morgellons. Include those studies in the resources. Being able to understand is possibly Lyme disease, finding a doctor who can treat that. And the reason why I was compliant with her therapy is because it produced a measurable result. With Morgellons specifically, so many patients are lost to follow-up because the treatment doesn't work. If doctors are approaching the issue like a mental disorder instead of a skin condition, they're not going to have the results, and they're probably going to lose that patient to follow-up if they really have Morgellons and they don't just mistakenly believe they have Morgellons, which occurs quite often. It must be ruled out with physical examination. So that was the blueprint for bringing me to a point where I was functional. I was able to rebuild my client base and provide them the service that they ultimately deserve for having faith in my capabilities. What is Lyme disease? Lyme disease is a bacterial infection, primarily caused by the spirochete Borrelia burgdorferi. Early symptoms include the bullseye rash. However, that is not always the case. Some studies put that at 60%. Some studies put it, I believe, at 40%. Fatigue, fever, headaches, muscle joint pain. Where it gets to be a problem is if it's untreated. That's not where the 10 to 20% comes in. 10 to 20% of treatment resistance is observed in early exposure patients. So those are people who weren't previously sick. They went out, they got a tick bite, the doctor gives them the standard treatment, and then they relapse after that. That happens to about 10 to 20% of Lyme disease patients. Lyme disease is a spiral-shaped bacteria. It's shaped like a corkscrew. Its structure allows it to, and propulsion mechanism, allow it to burrow in bones and tissue and organs. So anywhere this bacteria can drill into, it can start to colonize. It replicates, and it's hard to get those colonies outside of the body once they're well established. We don't have a way to pry open the human body and scrub out all the biofilms. That would be great if we did, maybe not, but right now we don't have an effective way to measure biofilms inside the body or to treat them. We have new emerging technologies, we have supplements, but it's not like pop a pill and you're cured. We're far away from that scenario. Lyme disease is primarily spread by black-legged ticks. These are Ixodes scapularis in the east and the Midwest. Ixodes pacificus in the west. That's in California. Related infections like tick-borne relapsing fever come from soft ticks, often in rustic settings. So I'm going to go ahead and share my screen here. I want to show you guys the different kinds of ticks that we got. We'll see if we can't make that working. Share. And okay. Oops, I'm trying to Sorry, guys. I'm trying to change the tab here on the browser. Okay, let me know if you can see that. Okay, good deal. So these are the different kinds of ticks. We have the American dog tick, the brown tick. What you're looking at when they're ballooned up like this is after they've fed on a host, typically a deer, mice, humans, and they balloon up like this because they're full of blood. Ticks feed by regurgitation. They suck in the blood and then they barf it back out in people. They're kind of like little hypodermic needles full of disease. Not all of these ticks are going to harbor Lyme disease, but there are other tick-borne infections that are of concern and can become problematic in the untreated stage. Anaplasmosis, ehrlichiosis, babesiosis. Bartonella is found not to be harbored in ticks. We thought up until recently that Bartonella was a tick-borne infection. It turns out that's probably not the case. We have a well-controlled study that looked at over 3,000 ticks in the United States from coast to coast, and Bartonella was not observed to be able to live in the tick gut to be transferred. A tick may be able to feed on an organism with Bartonella and have that DNA on sequence, but that doesn't mean that that organism is alive and thriving inside that tick. Dr. Eva Shapey up at the University of New Haven in Connecticut conducted a study where they looked at a tick population and determined that about 30% of those ticks carried filarial nematodes. And what we found, what Dr. Alan McDonald, looks like it paused the video on the live stream, guys. Sorry about that if you're watching on YouTube right now. I thought we were going to be able to share the screen, but that's okay. We'll get it back. Okay, we're going to stop the share. Dr. Alan McDonald, a pathologist in Philadelphia, studied a dozen brains of cadavers, multiple sclerosis patients, and he observed the filarial nematodes inside the patient's brains. And they were able to determine that those worms, those tiny parasitic worms, were actually infected and harboring Lyme disease themselves. So that should give you a little idea of the size of scale we're talking about. Filarial nematodes are tiny. You can't see them without a microscope. And, of course, Lyme disease is going to be much, much, much smaller than those. I think I've got a few more resources I want to share with you guys. I don't want to lock up the video on YouTube, so we'll think about that. What patients need to know. One thing patients really need to understand is that doctors don't often have training for this, and they're not always humble about letting people know. Dr. Joseph made a good point that if you don't know, just say you don't know. You know, because when you pretend that you know and you double down when things don't work out, instead of saying, hey, maybe I need to step back and look at this from a different light, that can erode the trust that the patient has in their doctor. And so if a patient approaches any scenario where it's not a Lyme disease specialist and they're concerned about Lyme disease specifically, they may not get the kind of result that they're looking for. Seeing the right kind of doctor, like using the right kind of tool, makes the difference. The other thing is, it can be empowering to get online and get together with other people who are going through the same thing. Lyme disease is a huge community online. And it's the camaraderie, the sense of community that people really start to miss out on. And I mean, miss out and not even really understand the consequences of becoming isolated. But I mean, when you're feeling horrible and you've gone to 30 doctors and you don't know what else to do, sometimes people isolate. We don't want people isolating because then they can just fall through the cracks. And when you're disappointed, you don't see any way out, that's a good way to lose someone. So we want patients to consider, if you're not online, getting online and looking for other people who and organizations who cater to and are going through Lyme disease themselves, and form those friendships and those connections. You know, people that can talk with you, be open with you, listen to them, listen to their stories, and build lasting connections. That's one of the biggest things that helped me get past the dissuasive nature of this affliction. Is when I got back online, I met other people who were going through similar scenarios. And just having somebody there to talk to talk with, to listen to hear what they're going through, that made a huge difference in coming back to society. So the other thing I want to talk about is the psychological awareness. Some practitioners are saying that if a panic attack lasts for several minutes, 20, 30 minutes, even an hour, that could be a sign of Lyme disease. It's not normal for people to have low-lying levels of aggression for no reason. So if you do the right thing and you engage with a therapist and you're just not getting any kind of help, it could be an infection. It could be a hard to diagnose infection where the tests aren't completely accurate, or you could have a different strain of a similar bacteria that can cause similar debilitation. And so that's why understanding the issue can help give you a different perspective. Maybe there's a different answer to my depression. Maybe there's a different answer to my anxiety than just cognitive therapy or psychotropic drugs. One thing a lot of people don't really understand is that Lyme disease, as I said, can affect every part of the body, but it can also impact your hormones. And that can cause a progression of further debilitation because you're not getting support from the endocrine system that you need to regulate your daily processes. This is something that maybe a Lyme disease specialist isn't as good as an anti-aging doctor might be. So, you know, a Lyme disease doctor might be able to help you get to baseline, but don't count out the other potentials to see different kinds of doctors. If you're aging and you're concerned, an anti-aging doctor might be the right kind of specialist to see in that scenario. If you see a tick on you, don't try to take it off with tweezers, and don't try to burn it. The appropriate thing to do, there's a tick tool, and it looks like a little plastic crowbar. And it's got the grooves in it so you can latch the tick and slowly remove it without, if you squeeze it, it's just going to shoot all that disease right into your body if it's attached. So there's a link in the resources guide that I put in the chat for a tool that can help you remove ticks more effectively. After the tick is taken out, there are a few companies, IGeneX is one, and there's also a government program now, I think it's called MeTix, which you can put that tick in a plastic bag with a cotton swab dipped in 90%, 85% isopropyl alcohol to kill it, and mail it to them for testing. If you pull a tick off you and you get rid of it, there's no way to tell what kind of diseases you could have potentially been exposed to until you've already been exposed to them. the earlier you can get treatment, the better the prognosis is going to potentially become. So ultimately, the purpose of this knowledge for the patient is to become autonomous. So you don't feel like you're out of control, but that you do feel like you have your hand on the wheel and that you are going to direct your recovery and that you believe that you can make it, because you can. If I can make it, anybody can make it out of this. It's going to be complicated, and it may require a longer duration of treatment than some people. But there are definitely options out there that weren't available to many people not even 5 years ago. My nonprofit is the new Morgellons Movement. You can go to our website, morgellons.io. If you want to take a free online course for learning about Morgellons, that's what we've been doing with our nonprofit there. Next thing we want to talk about is doctors and what doctors need to know. Dr. Joseph hit the nail on the head earlier when he said, when he was talking about humility, if you don't know, you don't know. And I think a lot of times it's hard for doctors to admit that, especially when 80 to 90% of their patient base is very happy with the service that they're receiving. And the people who aren't happy, they come in, they're angry, maybe sometimes they get belligerent, and they're desperate. They don't understand why the doctor can't help. At that point, if the doctor can say, I'm sorry that the treatment didn't work, there's something going on here that I'm missing. Maybe I can call some people to help me better understand this. That would do a world of difference in retaining and evolving the rapport that you have with that patient. If you can admit that you're not perfect, you don't know everything, something is wrong here, then that patient is more likely to want to stick with you through what you can do to try to help. And what you can do to try to help may involve taking specific educational courses on Lyme disease and associated tick infections. It's not something that's taught in standard medical school yet. That's probably going to change. The endocannabinoid system is another one that's just not taught in medical school. There are gaps. There are gray areas. But we have the options out there and the understanding to address them. A lot of doctors I talk to don't want to engage with the Lyme disease specifically because it's so controversial. And because, yes, some people really believe they have Lyme disease who may not have ever been bitten by a tick. And there is some evidence that Lyme disease could be sexually transmissible. We'll get into that in just a little bit here. But the biggest thing is that it's an area of study that most professional practitioners just haven't had the opportunity to engage with. I'm happy to say that the educational resources are available and they are affordable, and in many cases they will apply towards CE. So it's an opportunity, especially if you're seeing Lyme disease or potential cases that could be Lyme disease in your practice, especially in a high prevalence area. Lyme disease is all over the country, but it's in higher rates in some states than others. And a lot of that might come down to the reporting. Different states look for Lyme disease in different ways, and the reporting that comes through the hospitals and the clinics aren't always consistent. One thing doctors can really understand is that, myself included, Lyme disease is not the worst thing that I've been through or that I might ever go through. And so patients can be coming in with a history of trauma. They could be experiencing current stress. It's likely because housing costs are unobtainable. People struggle, especially when they're debilitated from inappropriately treated infection, from sustaining work, sustaining employment, getting and meeting their basic needs. And the whole time, they're looking at their life pass them by. They may be watching their siblings going off, getting married, meeting those life milestones, and they may look at themselves aging and not getting anywhere in life. If a patient has all that currently going on and it's not resolved from the past, they may experience prolonged treatment and treatment resistance. They may just not get there. So it may not hurt to ask, hey, do you have something going on that you want to talk about? Is it hard? Something you're going through personal? And then make a determination. Is this something that a therapist can help with? Because it's not always antibiotics and it's not always supplements. Sometimes the patient just doesn't want to talk about something that's really impacting them. Trauma and stress result in inflammation. And that's something somebody with Lyme disease is already going to be going through. So you can get the inflammation down, but if they're getting yelled at every other day, then they may not experience the remission that they deserve. Dental hygiene. I don't know why dental hygiene and the dental profession is separate from the medical profession, but it's something that patients need to consider. If they haven't been seeing a dentist or a hygienist for routine cleanings, those are infections right on the teeth. They may not be pathogenic, they may just be microbial, but there's some bacteria in their mouth, on their teeth, and the only way to get that stuff really responsibly addressed is to get it sandblasted out of your face every couple, at least twice a year at the dentist or the dental hygienist. That's another thing that can be holding patients back. There is an infection inside the oral microbiome called Treponema denticola. This infection specifically has been associated with Morgellons. It's been observed in the tissue samples that have been studied. This has even been most recently at Oklahoma State University, observed Treponema denticola in Morgellons patients' tissue specimens. So if they're not getting their teeth cleaned, then it's going to be real hard to bring a patient to remission, and that could cause frustration. They're going, I'm doing all these medicines that you prescribed. I'm being responsible. I'm getting my lab work. Why am I not getting there? They got to get their teeth taken care of because that's a major source of infection. The final thing I want to talk about is tobacco and alcohol. Nicotine specifically is demonstrated to alter microbes so that they become pathogenic. Tobacco smoke causes the microbiome in your lungs to turn pathogenic. This was in the journal Nature. It's in the resources here. Tobacco and alcohol are another one of those things, two of those things that can keep patients from truly experiencing remission. And it may be hard to, talk them into getting off that stuff. One thing that really helped a lot of people I deal with is being able to explain how those agents impact the microbiome, basically causing them to revolt against the body. And that's not going to help anybody get anywhere. Marijuana is not legal in every state. It's not legal in my state. Thank God we have hemp, and so people can legally access THC, which in some recent research has been shown to be a substitute for alcohol and to help people even get off alcohol. There are different kinds of spirochetal infections, and what I really wanted to touch on here was that no test is reliable because some patients just don't develop antibodies that would reveal themselves on those tests. There's a lot of cross-reactivity with spirochetal infections, but a clinical examination, a clinical interview can often help narrow down what test needs to be considered. Tests are not cheap, especially if the patient doesn't have insurance. And so if the patient has Lyme-like symptoms, maybe Bell's palsy, a swollen knee, but they don't ever leave the house. They have parties at their house every weekend, and there's a lot of people over there, and they're all having a lot of fun, but they don't go out in the woods. They don't do any of that crazy stuff, but they did get the Bell's palsy. That could be syphilis. If you're looking at Bell's palsy, it could be syphilis. That's the thing about Lyme disease and infections like it. There are a lot of imitator class infections that can look like other infections. But being able to determine the patient's their lifestyle, things that they may or may not be involved in, might help you determine, okay, maybe it's more likely that we should try this test instead of this test. There are no tests that are completely reliable for Lyme or syphilis, yet my understanding is that there are new tests on the horizon that are supposedly 99% effective. I think all tests are 99% effective until they get out in the real world, but, we'll see. Most of the time, often than not, patients, if they have these infections, they're going to show up on the test. So, it stinks when sometimes the infections don't show up, or instead of Lyme disease, they have tick-borne relapsing fever, or their Lyme disease test gave a false positive because of syphilis, or because they got all three of those infections at the same time, which is possible. A doctor's got to be able to get, if there is something there, it's got to be elicited in a way that is going to validate insurance taking care of that patient's debilitating disease. And fortunately, thank God, my doctor knew that TBRF is one of those potential infections. I did have a bullseye rash and tick exposure, and because of being able to get a positive test on that, there's the justification for treatment. Okay, now we're going to talk about Morgellons. And this is first of all, this is a rare condition. In 2 studies looking at a cohort of 1,500 patients, roughly 6% of Lyme disease patients had that skin condition. Lyme disease can result in a few different types of skin conditions. I always mess this one up. Acrodermic atrophians is one of them. It can also, of course, result in Bell's palsy, the knee, the psychological disorders that and behavioral conditions that we've been discussing. And Morgellons is a specific condition, though. One thing people don't really understand because of the media exposure surrounding it and all the theories, and they saw it on TV, a lot of people get the wrong idea about what Morgellons is. And so I'm going to briefly explain the scientific diagnostic criteria that's proposed. First of all, it is a skin condition. It's a condition of skin lesions. Morgellons is described in the literature as resembling syphilis, resembling secondary syphilis. It's those sores that would cause anybody to have concern, but that's where the diagnosis has to occur. A 60 times or greater handheld scope needs to be inside that sore to see if the characteristic microscopic fibers are present. I'm going to go ahead and share some images of what real Morgellons looks like so you can get an idea. Sorry on the YouTube. I'll see if I can't put in the description there so you guys can see that as well. Let's see. Get rid of this guy. Okay. So what we're looking at right here, this is from a tiny pinprick lesion that was on my thigh. This is magnified 240 times, between 120 and 240 times. And this had about a 2-inch strand of fuzz coming out of it. When I got the microscope and I looked at that fuzz, this is what it looks like. Now, this is characteristic because if at 240 times, nobody would be able to see this without the microscope. That would just be out the door. Put the camera in front. I'm gonna put the display in front of the camera here so people can see what we're doing on YouTube. Hopefully. You can see the gleam from the tissue on top of the threads. These are malformed hairs. The flat ribbon-looking fibers, those are malformed hairs that formed inside the tissue layer, not where it's supposed to be on the outside of the tissue layer, and it's trapped inside the skin being formed. That's what the scientific evidence has shown us. I want to show you a couple more examples that are not mine. Again, Morgellons is characteristic. Patients have been accused of injecting these fibers into their skin with a syringe. And as a matter of fact, there's a retired pediatrician I interviewed on my YouTube channel. I'll include that video, who was specifically accused of doing just that. So these things look nasty, but for sure we know that they originate from inside the skin. These are not plastic. They're not breathed in. Their origin of genesis is inside the epithelial layer of skin tissue. The best we can tell, the blue coloring is from human melanin production. I'll show you just a couple more here. And I appreciate everybody who's watching on YouTube for being patient. This one right here, it's also characteristic. You can see the fiber up here at the top left kind of poking and weaving in and out of the skin. That is very common. One time when I went to the emergency room, I saw something weaving in and out of my skin. I asked the doctor to look at it with the scope, and he was aghast. He said, "Whoa, that is weird." Morgellons looks weird, but the best we can tell, it's the interaction with the Lyme disease in the skin cells that results in these kind of artifacts presenting inside the skin. Okay, let me stop the screen share. All right. So,
Jeremy.
yeah, I'm right here.
Yeah, apology. I was in the elevator. I missed the photo before that. Is it possible to see that one once again, really quick?
Yeah, absolutely. I'm also going to jump over to the YouTube channel real quick and see if anybody is okay. We're doing good. Yeah, hang tight. Let me get that pulled back up for you. I want to thank everybody for sticking in there with me too. So we got a few people on the call here tonight.
You got me hooked, man. You're a great storyteller.
Thank you. I think Carol helped me out a lot with that
and
recently.
communicator.
Let's get the... Here we go. Sure. Okay. So in this group, this is our Reddit group, Real Morgellons on Reddit, r/Real Morgellons. I'll go back to, we've also got a Facebook group I wanted to show you guys. Let me pull this up here. No, not on that one. Sorry, guys. I want to find you a different one, but a really good one. Okay, this one right here. Can you see this, Dr. Joseph?
Yes.
Okay. This is
barely,
what
but
yeah,
that's okay. Maybe that's how it is. It's not easy to see.
the contrast isn't good. I'm also using HDR on my computer, so it may have something to do with it. This is what my thigh looked like right here. The little sore on my thigh. It had this long strand of these tiny. It looked like fuzz. And here it is from a different angle. This is not me. This is someone else with Morgellons. You can see these fibers are pinkish or purple. And here it is close up inside the originating sore, ulceration. So these fibers, we're not sure exactly why red colored fibers are colored red, much less the purple, but we do know the blue is from melanin. I'll get you guys just one more example, and we'll go ahead and
Do they fluoresce at all?
Some fibers do fluoresce. Let me show you the guide here.
It looks like there was a UV light showing on the first one.
Correct. Here's the guide I wrote, How to Photograph Morgellons Disease. This is the specific sore on my thigh I was talking about. And these are the different attachments I got for the phone to photograph it. Made a YouTube video out of it. This is the scope, specifically 200 to 240 times, that I used to get the real high resolution on that. But when I hit it with the UV light, it looked like coming right up through the center, there was one fluorescent fiber there. This is actually, these pictures right here, I get phone calls from psychiatrists, from just people in general, the public, telling me, hey, I used to think Morgellons wasn't real, but then I saw your guide here, and that really that changed my mind. So yeah, if you want to show some compelling evidence, this would be it. Yeah, go ahead. I'm sorry, can you repeat the question? Okay, guys, we'll go ahead and keep going forward. We're just about done. Okay. So as you can see, Morgellons is characteristic. The fibers are microscopic. The research indicates that they are invisible without sufficient magnification. So a lot of people come into the groups and they'll share pictures of like a strand of their hair that they're showing. They're holding it and they're going, look, it's swaying and it's moving. Unless it's invisible without at least 60 times magnification, then it's hard to determine that is characteristic for Morgellons. Also, it's got to be embedded inside skin tissue. Once something comes out of the skin, it's hard to determine where that came from. So the two criteria that we have for characterizing if it's Morgellons or not is, one, is it microscopic so that it's invisible without at least a 60 times magnification, and two, is it actually fibers that look like they were injected inside this person's skin. They're not supposed to be there. They obviously look abnormal. But the most important part is that they're embedded inside skin tissue. It's unbroken, so you don't see an incision mark where somebody cut and then stuck those in there. And they're so small, and the arrangement is impossible for someone to place them in there artificially. That's where they grew from. That's what the science is showing us. Remission is possible for Morgellons. I don't have a lot of sores, and the sores I do have, they're not fuzzy around the edges like before or right in the middle of treatment. But I still do get, a couple, 2 or 3 sores on my skin. They're manageable, but they're not comfortable. It's not running my life anymore, though. With the right kind of doctor, I was able to escape the despair of not seeing a way out. And realizing the things that I was doing were dumb and not effective. Being able to find a doctor that knew how to treat this from different training, and that treatment was being effective, is what really brought me to remission. So, there's a way out, but it might take stepping outside of the comfort zone to see a professional who specializes in the potential that it could be Lyme disease. And if it's a problematic case and therapy's not working, the hormone treatments, they're helping, but they're not working, maybe it's time to take a look at the potential that it could be Lyme disease. Lyme disease is more than an infection. It's a whole life-changing phenomenon. And a lot of people, when they go through it, they become humbled. A lot of people, though, they go the opposite way, and they become very egocentric. And the Lyme disease consumes them. It becomes their entire persona. people in the Lyme disease community realize that that's not healthy and that there are things outside of Lyme than Lyme. But it's not fair when someone does advocate for Lyme disease, for better treatment and for awareness, to say that they're fixated on it, that's all they ever think about, that's all they ever talk about it, because 99% of the time that's not true. What we need to recognize that is going on there is you're talking to someone who doesn't want to hear anything about Lyme disease 99 to 100% of the time. And so that one time that you bring it up, you may get falsely accused of being obsessed and fixated with it. Just realize that that's that person's training. They've been trained to marginalize the potential for Lyme disease. It could be your own family, which, is sad. It could be your doctor, which is concerning. But as we go forward and the federal funding for Lyme disease is implemented through our government agencies, the Department of Defense, the CDC, and the NIH, doctors are going to, in general, get better treatment or better training so they can treat Lyme disease more effectively. Again, I want to thank everybody for making time to stick here with us. Looks like I finished up about half an hour early. Don't think we missed anything, but I'd be more than happy to open the floor to the questions if anybody has any for me. Thank you.
Yeah, that was excellent, in more ways than one. I didn't know you were such a good speaker.
Yeah, I did a little bit of MC stuff back in the day.
Yeah, no, you sound like you've done this before, and it just comes across. It really hooked my interest, and kept me focused on your just the way you delivered it. So and the other thing I appreciate is coming at this issue that, look, these things have to come out, and we as anti-aging doctors, we have to not go with the company line anymore. Think that these things are just little sideshows, or it's a little thing, because I know that it's not, and it's not just because of my dreary life over the past 5 years. It's because I happen to have patients 8 to 9 years ago that didn't make sense and sparked my curiosity. It was frustrating to not understand and know, especially after having 10 years of regular medicine experience as an attending, and then multiple years of anti-aging, regenerative medicine, peptide therapies, functional medicine courses. And although Lyme was brought up several times at the A4M lectures, I can say that it's hard to grasp it unless you're immersed in it. And when I started to receive patients for peptides to help them with their detox programs, now these were patients primarily being treated for heavy metal toxicity. Well, one of the questions I had was, why is it that these people seem to always have Lyme and mold? How did they get this, and then they got that, and then they got the other? That question still exists. Some of the things that sort of made sense is that parasites, they would have parasites and Lyme, and I was just confused. Well, here's the harsh truth. What became apparent, because I was seeing so many of these patients all over the country and even overseas, but especially in hearing the similar stories that they had mercury in their amalgams, and somehow they had Lyme, but they don't remember getting a tick bite. Some of them do, some of them don't. Parasites were completely confusing to me. the truth is we don't get any education whatsoever. And, I'm the big mouth, but I don't care. Assassinate me. It's suppressed by design. And that doesn't make your blood boil. That's evil. Jeremy, you said something that I could absolutely resonate with. You said it calmly, unlike me. You said, well, one has to, in order to hold on to a business, you said one has to be able to plan, needs to be able to get to work, he needs to be able to sleep, he needs to be able to, yeah. If somebody's seeing, if you're somebody's coming to see any kind of a practitioner, which is, it's not just doctors, it's in general, that is a big deal. What would cause somebody to not be able to plan, to not be able to have difficulty going to work? What would it take? Because if you tell them there's something wrong with their head or they just need to cheer up or whatever, especially if they are extremely aware, it causes a it's not just a disappointment, it's an insult. Yeah. It honestly it triggers anger. Because what you're saying is you're talking to somebody like they are a 8-year-old child, somebody who's accomplished, who's survived this crazy life, because it's not easy for anybody in this crazy world. And when somebody says they're having trouble planning, going to work, some of the other things you said, sort of basic things like almost like, duh, what could possibly be causing that? And Jeremy, now you said once the Lyme gets into your brain, right? That's when the inflammation and the antibodies start attacking it. What the sensation, if you don't have it, okay, imagine what sector of society typically is not able to go to work, is not able to plan. If you tell them to draw a clock, it's crooked. They're demented. That's what it takes to have that issue. There's a serious issue blocking your ability to plan, to get up and go to work. How hard is it really to go to work when you're not dealing with something unusual? You just get up, take a shower, and you go. Right. And I think that's the biggest take home, because it's not easy if you, and to see it from the other side. It is difficult to understand when you haven't experienced it. And I understand I'm not perfect. Okay. I've had my own, I don't know if I said things that were offensive to people. I probably still do. And I try to be cognizant of what I say. Be very careful, especially when dealing with patients day in and day out. You said something else important. Oh, if the doctor if most of the people that they're seeing are happy, right? They feel like, great, I got this. I figured it out. I'm doing, and then you get this subgroup of almost like complainers. Not complainers. It's not resonating what they're talking about, because you don't have, it's not in your perceptual field. It's not, there's a blind spot in this because it doesn't, first of all, again, you're not, it's not something that's taught. your head is filled up with all kinds of confusing information. You see some things that work. Okay, I give the antibiotics and steroids, and they go off on their way. And I can tell you, this is not an easy disease state, and I'm still learning. How about this? Imagine that it's meant to be confusing to mere mortal humans. I mean, that kind of changes the whole paradigm. Imagine that there's somebody more sophisticated than you. They have science beyond your imagination. Well, it's a little easier to accept and shake your head and go, man, it doesn't surprise me if this is not easy to figure out. I'm curious why those pictures that you showed, why they look familiar to me. I haven't looked at Morgellons. I've looked at when I'm trying to figure out whether it's Lyme, parasites, or something completely different. And but I did have the suspicion that there's a connection, and the connection is the shapes of those skin lesions, of those threads. They are undeniably familiar to me. They're related. Now, of course, I'm sure there's 1,000 things that usually I come across everything how I'm not right. And that's fine. It's good to have some checks and balances, but I'm right. Because I look at things, I look for patterns all day long, 24 hours a day, and I know when I see something that is undisputably related, and there is evidence. It's just that the evidence is found in the places. Yeah, it's almost like it's not going to be handed to us on a silver platter. We have to find the clues wherever we can find them. That is a good way to see it. And at least what that does, and I'm going to end it with this. I don't want to turn this into this is your lecture, Jeremy. But I want to speak on behalf of the physicians here. What we have with that kind of mental mindset that I'm suggesting is a way to open up the door to what we're really looking at. If something what do they say? It smells like a this, it feels like a this, then it's a that or whatever. Doesn't mean it's proven. It just means that the door is now open to get clarity, and not to be in a perpetual state of what everything isn't. How it needs, I got to go to a university. I know I don't want to offend anybody, but how I need to go to a university and get a study when they haven't done that. They don't know what it takes to do that. And I'm talking about an urgent issue that needs attention now. Or it's got to be something, and look, it could just be the process and the proper way of saying, hey, did you consider this? Did you consider this? Okay, good. We just want to make sure that you are sure that you're not missing anything and we're helping you. And I respect that. Okay, so don't take it the wrong way. But this way of thinking and just it's called being open-minded and looking for the clues that suggest, and trusting your intuition will open up the door to finally getting clarity versus constantly never having clarity. It shouldn't take 35 years and you still can't say anything definite. There are definite things in this universe. You just have to see it. And that's really that's the main point. So that's how Lyme in this issue, it is confusing, and it takes a long time, and you got to see it from a lot of different angles. You have to be immersed in it. Jeremy, you certainly have the the painful journey of learning. You sound like a expert on the subject. Don't ever, I don't doubt that whatsoever. You know more what you're talking about because you've been through it, and and you're talented in more ways than one. And maybe perhaps we can learn through the investment in the pain that you've been through, so that we can finally come to terms with what's really going on. And that's all I got to say.
Thank you, Dr. Joseph. Those are some compelling considerations. You know, nobody knows everything, and we're all just trying to do the best we can do, right?
And then that's what it is. Yeah, exactly. And I'm the icy cold truth guy. I just want to make sure that we don't sugarcoat, and we don't have the company line, and we don't put on our niceties. We don't have time for that now. This is not 2015. This is 2025, and we're under attack, by the way. And this whole thing, I'm gonna say it to the face, into your face, all not you, Jeremy, to the group. It's like dealing with family here. You know what I mean? You bicker. Um, we're under attack. I take this very seriously. And Morgellons and all those things, from everything I've come across, connecting the dots nonstop, 24 hours a day, because that's what I do. I don't have other things more important to do. That's why I know what I'm talking about. And I can give you all the examples. This is all biowarfare. This is Stalingrad in your blood, in your skin. And just because Morgellons shows up on the skin doesn't mean it's not in your brain, in your tissues, in your organs. This is biowarfare. So I'm the big reminder of what's going on here. And you can watch more people die and chalk it up to everything other than the reality. And I'm here to remind you, it's war. And that's and with that, happy note.
No, you touched on a point that a lot of people raise, and that's, you know, is Morgellons a disease? And so the evidence indicates that it's a condition, and that Lyme or similar spirochetal infections are the disease. Lyme disease will get in the brain, get in the knee, get in the organs, the bones. But when it gets in the skin, it can potentially result in Morgellons. There's evidence out of the University of New Haven, which it's being worked on right now, to determine the genetic predisposition for a patient to develop Morgellons. There are 9 sequences of significance that are being investigated currently. So that's the thing also with Lyme disease, is often it's age and genetics that determines, and epigenetics, you know, like stress, that determines how a patient is going to present, and if their prognosis is going to be good, they're going to clear up soon, or if they experience treatment resistance. So yeah, there's definitely factors. I think a lot of people, you know, like you said, I mean, it's not part of med school, and you know, we don't have all the time in the world to do every CE that we'd like to do, and that's money. You know, those classes, they cost money. So, you know, hopefully the training becomes part of the standard. Current doctors get a break on that CE so that they can afford to take it, and everybody benefits. Everybody comes out a winner.
I am curious to ask Dr. Joseph and to you, could there be a turbo version of Lyme?
A turbo version. That's a great question that I could only speculate on. And I mean, if there's a turbo version of cancer, what would cause a turbo cancer? Would it be that something is switched on? And what is it switched on by? Well, then is it possible for the symptoms of Lyme to be turned on and accelerate? One thing I do know is based on studies on similar fibers under the microscope is when they exposed them to frequency, that they sort of switched on and started to grow versus the control, which didn't. I realize that's not a double-blind study and, $1 billion investment, but common sense dictates if you do that over and over, this one grows, that one doesn't. You turn on the frequency here and that one not, that something's to be said about, is there a connection between the frequency and the growth of those fibers? I'll tell you, me being electromagnetically sensitive, that I have an app that can show when there's a high K index, which just means a lot of frequency in the atmosphere, and something that shows the human frequency. And I tell you, when it was bad, I was at the clinic, and it has at Post Haste, it has a compound pharmacy, and I broke out so bad on my neck and my upper back that the pharmacist was, I mean, I thought I could just hide like a little kid, things that people can't see it. I mean, I could feel it, but I didn't think it was visible. And it was like, oh my God, she immediately grabbed some steroid cream and put it on. I'm just like, oh, because it just, once it dissipated. I later went on to take pictures with fluorescence, and it does have fluorescent fibers coming out of it, which indicates to me, or asks the questions. The question that I ask is, are we dealing with a version condition? Okay, not a diagnosis or with a disease of Morgellons, but an expression of rashes involved with fluorescent thread-like materials coming out. And I'll tell you, there's others. The one thing I hope is realized is that I'm speaking to multiple people consistently almost every single day in different parts of the country, hearing the different, comparing the different, hearing the different complaints and seeing the commonalities. And guess what? There are others who have this too. And what's the difference? Well, what if the difference is those who are feeling it actually have mast cells that are activated? Their body's trying to get rid of it. And those who don't realize that they have it because they don't mount an allergic reaction to it. Their mast cells are not as sensitive and hyperactive as their intuition. Which typically when I talk to them, I don't get the sense that they have a lot of intuition either. It's true.
That's an astute observation also. I mean, that does happen.
Yeah. And so that's and it's just a point to ponder on, is the difference between somebody who has the symptoms, the person who is, like you said, epigenetically predisposed to have a mast cell activation, a strong mast cell activation response that alerts them, but also that they feel, that causes a cascade, an allergic response, a histamine release, and the redness and the itching and the bumps, on my head, my scalp. Yeah. Now it all makes sense to me, because I remember when they first started to flare up. Here I am 35 years into my education, and I still can't figure out what's going on. It just doesn't fit it's not psoriasis. Yeah. Well, what is it? Well, yeah, when you put a fluorescent lamp to it. Oh, and then of course, then the person who always has to shut of course, then there's the comeback. No, it's a fungus, because that's that's a whole nother thing. When you look at this thing from every angle, all the time, 24 hours, every day, constantly, a pattern emerges where you can see the connection between symptoms that do not make sense and diseases that were not taught and happen to be bioweapons. Bioweapons that are directed at us because they cause fatigue. This is talked about openly in the media. There's no holding back on the truth of what fourth or fifth generation warfare is. It's a warfare that they can't see, that is making them passive because they're too tired to be concerned anymore, or that these things are in your body and they're having whereas my body is like, what the hell's going on? It's flaring up my brain and flaring up this, and I'm burning up all of my adrenals, and I've got antibodies that, my body knows something's wrong. What if yours doesn't? And it's making it, put it like this. It hit me. I said, why won't anybody read the books I tell them to read if they're going to argue against me? How's this for a hard hit? Because you're too tired. It's too exhausting to order the book and read it. That's a sign. That's a sign that you're more affected, that you actually are affected, that this is, to me, it's in everybody. How could it not be? From what I've seen this year in the air, and I don't care if you're tired of hearing it, because we're this close to the reality being right in front of. I don't know how many people have to die and how many people have to be sick before you realize it's not because we're stupid. It's not because we can't figure it out. It's because we can't get our diet right. We just can't. We got to have a positive attitude. I'm here, having learned this through the exhaustion with clarity. I don't want to have to wait till something really bad happens to have nothing left but the satisfaction that I was right. That's not the point. Ideally, we would be preparing and helping each other out, figuring out fresh, food that's not contaminated. How do we clean our countertops? What works better now? We can't think the same. I found that distilled vodka is probably the best cleaner. It's untainted. There's no contamination in it, and and it washes this very sticky, glow in the dark substance that's blowing everywhere, that creates weird shapes. If you look for them, you'll see them. You'll see them outdoors on the sidewalk on a rainy day. You'll see this kind of strange shape that emerges when this stuff, however it works, it's sticky and it responds to electromagnetic frequency. Well, that, I guess, having gone on a detour, Michelle, that's my answer. That this stuff is potentially, well, in my mind, it is promoted by electromagnetic frequency. If that frequency is turned up, I think it's fair to say that this could have a turbo-like quality to it.
So my belief is that a lot of it comes down to duration before treatment for most people. Most people, 80 to 90% of people are going to respond to standard antimicrobial treatment for Lyme disease. Maybe that's a month of doxycycline and they're fine. A lot of people, though, they've gone through a lot more social stressors and epigenetic exposures. I used to live in a place that was mold. It was a dilapidated environment, the party house, but there was black mold on the walls, and that probably contributed to the progression of my presentation. As I detailed earlier, trauma and stress are something that can really inhibit a patient's ability to go into a remission. and that's because it's chronic inflammation. Every time you get yelled at, screamed at, you get in a fight, somebody calls you yelling and screaming, wanting something last minute, that causes inflammation. So as far as like a super Lyme disease, I think it really depends on the patient's what they're going through. You know, if they're living in a cardboard box down by the river, then they're probably not going to experience remission. And yeah, their Lyme disease is probably going to be a lot worse than somebody who is able to have 3 hot meals and a bed to sleep in at night.
Yeah, you make a great point. And remember when I said that, why do these people always seem, when I was trying to figure out what was going on, why do they, there's always mold always associated with this? Well, obviously they're presenting, you know, somebody who doesn't maybe have that mold exposure. Maybe they're not, you know, they're not tired to the point or having symptoms to the point where they, or maybe they're not, don't realize that, again, they're not necessarily reacting to it. There's something about the synergy between the mold and the Lyme, that they work in concert.
Well, Lyme disease. I'm sorry, Dr. Jeffs.
No,
Lyme
go ahead.
disease it's demonstrated to disable the innate immunity. The party house I was living in, I had roommates, and they were fine. They were living in the same moldy environment, but as far as we knew, they didn't have Lyme disease. So if Lyme disease is present, I think somebody might be more susceptible to Lyme disease. That's my belief.
Yeah, no, absolutely.
I'm sorry, vice versa.
So,
if somebody has Lyme disease, they might be more susceptible to mold. I want to be clear about that. Sorry.
Well, no, what I was saying what I was trying to say is that there's a connection between the two, that they may actually be working in concert. Like the mycotoxin may be there to break down the blood-brain barrier so the Lyme can get into the brain. Okay. Now, keep in mind, I see things not from a random universe. You know, everything is just random, and we have to come up with every reason why there isn't some truth out there. But the pattern, and you know, I always wonder why doesn't mold grow anywhere else? Why does it specifically grow on the materials that our housing is built out of? I mean, I'm not proving anything. It made me wonder. It made me wonder if so many of these diseases seem like they happened after 1990. You know, a lot of them, as if they just spontaneously sprung up. They seem so perfectly attuned to it. They're working, like the heavy metals do their thing. They spread out. They block the different pathways. Okay, and they kind of form a web network around the body. They're perfectly. We get the perfect ones that to mimic, you know, potassium, to mimic magnesium, to mimic calcium, to mimic. I mean, you could make it just goes on. It's so perfect. It seems like it. And the mycotoxins have this perfect, you know, orchestration of suppressing tumor suppressor genes or opening up the blood-brain barrier, as if it's all part of a concerted effort to, well, I mean, if somebody wanted to do a fourth generation warfare tactic, and they spent many years before the majority of people were aware that this was happening, that they would have this down to a science. Now, who's being affected the most? Well, like I said, I've got my theories. It seems like certain personality types are more likely, and you brought up a great point, Jeremy, and I absolutely agree with you. People who have had trauma when they're younger, especially for those with autonomic dysfunction and panic attacks, are much more likely to become debilitated if those receptors are already, if they've already had chronic inflammation, chronic microglial activation, and I would say affecting their neural pathways with that trauma, or decreased production of the conversion to certain neurosteroids that would normally buffer any stressors to those neural pathways, especially the autonomic nicotinic acetylcholine receptor, that that when they come in contact with heavy metal toxicity, why do they all come together? Is it possible? Let me be the bad guy here. Is it possible it comes from the sky? Is it possible it goes in through the water? Okay, and that those people, if you look at their epigenetics, they tend to have difficulty breaking down histamine. They tend to have glutathione polymorphism, so they don't produce as much glutathione. They tend to be you probably heard this one, that MTHFR. Okay, and so there's a very specific female that's classic. I mean, the ultimate classic case is a female strategist. Okay, in the Myers-Briggs, it's INTJ. ENTJ is close behind, and there's a reason. There's a pattern that's based on their dominant neuro pathways are indicative, and the cognitive stack shows that they will have a certain how they will experience the symptoms is based on how their brain, what parts of their brain are dominant and function. Mine is going to be more for brain fog than any other type because I'm extremely dopamine dominant with no connection to, any, and with norepinephrine would be the opposite of dominance. So, and some people are going to have a dopamine dominance, or they're going to have it kind of a little bit more dopamine dominance. They're going to have some norepinephrine dominance, and means they're going to have less of the brain fog that I would have, but they're going to be more liable to have body issues. And if that doesn't make sense, I really want to go through it again with people who actually give a shit. I can't help myself. But seriously, I mean, it's mind blowing. At least the epiphany is real, and it's so clear. You can even take the different presentations of Parkinsonism and associate with this type is going to present like this, and this one's going to present like this. It's because of their neural pathways most of the time, as a framework to open up the door to see for sight. Then you can hone in on it instead of being shooting in every direction, figuring out what isn't true. But ISFPs like yourself, Jeremy, they are introverted feeling heroes, extroverted sensing parent.
I'm a ENFJ.
Well, we'll have a conversation afterwards.
That's what it told me the last time I took it. It was something else a couple of years before that.
Yeah. The problem is those tests are wrong most of the time. It's because our mood can affect it, and how we see ourselves or who we imagine ourselves to be. The questions can throw people. Intuitive means something different to different people. So there's a lot of confusion. I can tell you this because I know what I know. I wish I could tell you. I was looking at your facial features earlier to even support that even more. And you look, we need more people like you in this world because something about you. Yes, ENFJ. I understand what you're saying. They are the gosh, I wish I could come up with a better way to say it. There is something there, and that's similar. The only difference is in the difference between introverted feeling and extroverted feeling, and extroverted feeling has a different. They're both comforting. Introverted feeling is is much more internal, based on internal values, and making decisions based on deeply held beliefs. And extrovert feeling is just it's like more like a happy poodle.
I wouldn't
Right?
say that. It's like, remember I was talking about earlier when my doctor put me on rifampin, that low-lying level of aggression just completely disappeared, and I felt like I wanted to be more social. I wanted to get out, talk to people, be a part of society, you know, interact with other individuals, you know, and I still feel that way today. I mean, I don't like being isolated. I love being out there talking to people, having a good time, breaking bread, you know, playing the games. I want to get back in a co-ed softball league again. There's so much opportunities, you know. You can't just sit in the house all day. You'll miss out on life.
No, I understand what you're saying. Look, the Myers-Briggs is complicated. It's like Lyme disease. I hear that this is a good analogy. It's like Lyme disease. It's very complicated, and it all it is a language and a code, and to make fine distinctions. Um, when you talk, I understand what you're saying. If I was just to go by hardcore algorithm, I would say I understand because I've considered those things already. Just like Lyme, you have to consider so many things before you start to see the light. Same thing with this. It, you know, it's a fine distinction. Um, and people, a lot of people want to be more social too. And your sickness definitely kept you from being social, but it's not a defining factor of what makes an ISFP versus an ENFJ. And I could go more into it if I sit down and take what you said, okay, and sit with it and reconsider, which I will, and just say, is there something I'm missing? Okay, so I got to take my own medicine. Is there something I'm missing?
No, I mean that's healthy for in any profession to step back and say, wait a minute, maybe maybe there is something that I'm missing and I need to look into. And more often than not, you'll find something new every time, you know.
Yeah, and I agree. And I say that because I want to make sure I take my own medicine, and I want to make sure I don't step into that and not disregard what you said. Um, I'm gonna look into it more, and if it comes out that there's something like, okay, if it comes out ISFP is the final conclusion, and but I can say the one thing that is the deal breaker that you understand, and if we're on the same page, if that's the case, I will definitely I'll definitely let you know. If I say, you know what, man, okay, I maybe I don't know, and we'll leave it at that. It's not it doesn't matter. Um, but here's the point. Um, you're right. An ENFJ would be more likely to have symptoms of Morgellons. They would be. You can even see it in the movies. Um, there's certain scenes where you always see that they have skin issues. You'll see it in Wonder Woman. You'll see it in Gattaca. You'll see that there's a tendency. I know one from a wellness group, and sure enough, she's it didn't. I've seen it where she's had that sort of autonomic triggering of a rash like condition that is probably related to this. It's just she doesn't have it in full blown, and her situation is different, and she's doing a lot of things that are probably already counteracting it because she's been doing a lot of the anti-aging stuff. But I see it over and over. It's those who have introverted intuition and extroverted intuition are and especially introverted intuition um, are extremely vulnerable to these conditions because of their a lower amount of serotonin to help buffer their autonomic nervous system. The nicotinic acetylcholine pathways will not have the benefit of being dampened by the low serotonin. I got to come up with a word that's opposite of dominance, and they're more likely to have an autonomic activated autoimmune inflammatory response that can lead to, over time, to adrenal insufficiency, which can lead to crashing and hormonal crashing, and lead to isolation.
Oh yeah, yeah. It's it's a vicious cycle. You try to do the responsible thing, go to the doctor, get taken care of, and it doesn't work, and then you just keep going back over and over again. Yeah, it's no wonder people isolate, but Morgellons specifically is a condition of skin lesions, and I'll include some more images, but like I said, the research.
And that triggers. I'm sorry, that triggers the mast cells, so that triggers the histamine response and the scratching and the itching, the severe itching. Okay, I forgot to make that connection, but go ahead. Sorry.
Yeah, so the Morgellons sores, they're going to appear whether the patient's scratching or not. It's not a result of lacerations. Syphilis in particular, it promotes the excretion of collagenase, and so you have that increased collagenase, which the purpose of that is to break down tissue, and that's one of the primary mechanisms of ulceration in patients. Another thing we determined was recently in a skin lab, we put Borrelia burgdorferi in with and relapsing fever Borrelia into a co-culture of fibroblasts. And that infection specifically increased the amount of collagen that those fibroblast cells were producing. And in Morgellons patients, there are artifacts inside the skin. We call them follicular casts. They're casts of the hair follicle created with collagen, human collagen. And so when people will start talking about, oh, they have worms in their skin, that's what they look like. They look like little worms. Some people have described them as shrimp. They're white. They're whiter than the tone of the skin. They look almost like paper white. That's just straight up collagen, junk collagen that's filled up the hair follicle and resulted in a cast. And so we know that Lyme disease has this mechanism to accomplish that. We see Lyme disease in specimens that we're studying. The horse is right there neighing. We got a pretty good candidate for what could be causing Morgellons disease.
And that's what you're and what specifically?
Spirochetal infections.
Oh, okay. So again, it's related to Lyme.
Yeah, Lyme Morgellons is described in the literature as resembling syphilis. The classification and staging of Morgellons disease lessons from syphilis compares the two infections. 100 years ago, if a Morgellons patient walked into a doctor's office, that doctor would probably think that patient had syphilis.
That's a great point. When you think about a syphilis lesion, at least the image I have in my head, it's like a crater, right?
Yeah, it's the hyperpigmented, raised, ridged lesions that the gummas. They're called gummas.
Interesting, gummas.
And they're wet inside. They're moist inside.
Like gummy or gummy gummas.
Gumma. Yeah, that's a syphilic ulceration. And so those are. I don't know if you guys can see the scars on my skin where I had those sores all up and down them, but it was covering a significant portion of my body, and that's one of the main reasons why I withdrew. Like I said, I'd been through a lot of other things besides Morgellons, and so there were a lot of reasons why I withdrew. But for Morgellons specifically, I wasn't presentable. I couldn't go out and buy new clothes because I was worried about getting blood all over it. I couldn't go out and just strike up a conversation with somebody because they were horrified. Here's this guy. It looks like he's got leprosy.
Leprosy, yeah.
And that's, ironically, I'm on a leprosy drug right now, and it's very effective. That's a Dapsone is one of the drugs that's in my cocktail.
Interesting you say that, because I was just talking to. Are you familiar with a Lyme specialist? His name is Richard Horowitz.
Yeah, I know Dr. Horowitz. Yeah, he's prominent in the community. He authored the, if I'm not mistaken, he was the primary author on that research which shows the double Dapsone combination therapy is effective. That's not the specific combination that I'm on, but a lot of those medications that are in that protocol I am on, and they do help quite a bit. Dapsone was a game changer for me personally.
Interesting. No, I had a conversation with him earlier today, and it was really enlightening. He has so many years of experience with this, and created these protocols. And he mentioned Dapsone. What I need to do is just sort of absorb it. What we talked about, and I just was very interested in seeing if there's more behind Dapsone than meets the eyes. I think that's from where I'm at right now, to see if there's more between there's more to it than it's just a different antibiotic. There's something more.
It's not even an antibiotic.
Thank you. Okay, what is it?
Oh, I don't know, but
what in general, or what's your take on it?
I really don't know what class of medication it is. I will tell you though that I don't think by itself it would work. I have to take folinic acid with it. My doctor told me I had to do that. And she did also put me on the methylene blue, which has incredibly helped with my energy level. Sometimes on that stuff, I feel like I'm a 35-year-old kid again.
Yeah, that's interesting. Yeah. And methylene blue, we talked about that in the context of photodynamic therapy, and combining potentially photodynamic therapy, methylene blue, and hyperbaric at the same time. But the question that went through my head is what if it's already penetrated the brain? And I want to leave those options still on the table. I personally haven't had a chance to do it, and it's just because our red light machine has to be completely disconnected, which takes almost 2 hours. And it's because it's too big to bring it into another room. But that's something I still hold on to, as this was some backing and research through for which Dr. Halasa had talked about earlier, about Lyme, and I can certainly see the connection. I just want to figure out an easier way to test it out, so it can be done over and over, not have to go through deconstruction and reconstruction every time. Dapsone, I'm glad you brought that up. Something I was thinking maybe it wasn't an antibiotic, but if he brought it up too, and he's the one who did the study, yeah. I'm just curious there's got to be something there.
So you can the ILADS training program is called the ILADEF, ILADEF, if you want to engage with their CE. That's my doctor, she works on the board at the ILADS as the treasurer, but that's probably the best place to get the most up-to-date information outside of the conventional methods. There was something you said that I wanted to touch on. It, speaking of brain fog, the cannabinoid system, the endocannabinoid system, I really attribute a lot of the lifting of the brain fog to the hemp gummies that I've been getting, the THC gummies. They got the Delta 8, the Delta 11, all that crazy stuff in it. And really, I don't get high. I just experience a clearer head, alleviation of pain, just a sense of what you call it normalcy, so I can go to work and accomplish my job. That really had the biggest impact on the brain fog, I believe, was the hemp-derived THC gummies. When I started taking those, my head really cleared up a lot. Yeah, choline, I take that stuff, PQQ, CoQ10,
What? Oh, sorry. Oh,
the standard brain supplements, but I think that because THC is demonstrated in some studies to remove Alzheimer's plaques from the brain. And so complementing the endocannabinoid system when your body can't produce enough cannabinoids is another route that I believe that practitioners can take a look at in helping resolve a lot of these complicated issues like brain fog and chronic fatigue.
well, it's interesting you say that because I'll just say one more thing on personality type. Those who are high in introverted feeling are that's an endo that's an uh, what's the word? Not endocrine. It's a endorphin pathway, and if that's a hero function, like me, it's dopamine. Extroverted intuition is a dopamine two dominance. That's explorative. It's abstract, and all it wants to do is look for patterns, and enjoys it and gets high off of it. Um, when I don't have it, I'm paralyzed. It's like I got to be normal. um, no, I mean, there's no pleasure, and it's like not being able to function. It's like being mute. Um, it's like can't think, and there's not the dopamine helps to activate norepinephrine, which allows you to get off your ass and go do. Because I'm an introverted extrovert, if you want to call it that, because I'm dominated by an introverted function, which is exploratory in my head, simulating life in my head. To go do requires high amounts of dopamine because my norepinephrine levels are inferior. In fact, I have to get mad to get myself to do something, literally, because it's a brainstem function. Um, the people who theoretically, I would think, okay, would be the most um, affected positive, or would feel the cannabinoid therapy. I can see if one had a very high level, their endorphin pathway was their dominant.
It's a different system. It's entirely a different system
Is it
altogether.
completely different? Am I off? Okay,
Yeah,
so the cannabinoid and the endorphins are not. There's no relationship.
the endocannabinoid system, your body has receptors along the
Yeah.
system. Those receptors are everywhere in the brain, in the gut, in your arms, and your fingers. And your body produces endogenous cannabinoids for that system. When you get older, you produce less of those, and the receptors are left less receptive to what your body produces. So, really, cannabinoid therapy is a nutritional situation. If your body can't if your body can't produce enough cannabinoids, endogenous cannabinoids to complement the system, the cannabinoid system, which does impact mood. I don't know if you know this or not, there are some strains of cannabis that improve motivation and social interaction. People use cannabis specifically so they can feel more extroverted, so they can want to go out and engage with people and be more social. And that's complementing the cannabinoid system. When you use cannabis, it's providing cannabinoids. It's not providing dopamine. So it's a different kind of system.
Well, yeah. Well, I didn't mean dopamine. I was referring to the yeah, the endorphin pathway, not the dopamine pathway.
No, it's
But you're saying the endorphin pathway that's different cannabinoid, because I was actually starting to wonder too. I'm like, wait a minute, are those two, because we've got cannabinoid receptors all over our body, but maybe that pathways are more spread out than just the brain. I from my understanding. No, you bring up a great point that perhaps this is different. So yeah, I think it's something. It makes sense that this is something for anybody to consider, especially if it had that big effect on your situation, which was seemingly impossible.
Yeah, I mean, frankly, I was experiencing pre-dementia, and that was very apparent. I would say something, and then 2 minutes later, I'd repeat the thing that I just said, and my girlfriend at the time or whoever would be like, "You just said that like a minute ago," and I couldn't remember doing it. And when I got on that combination therapy, the cocktail of antimicrobials and supplements, my memory came back. And I didn't realize how bad it was until I started remembering very key events that had occurred in my life that I had no recollection of prior. And it changed my personality. It made me more cautious. It made me more present about what is going on around me. Because before, it just felt like I was a wrecking ball. I would just come in and do whatever, and I didn't really think. It was a very impulsive time in my life. And fortunately now, stop, I can think, I can make the normal and the right decision. And, that's something that a lot of patients need to be able to experience to measure their recovery and their remission. If people can't go to work, like we were talking about earlier, they just don't feel like it. They've got too much chronic fatigue. They don't feel passionate about what they're doing. And a lot of people, they do what they do just because they have to, but they still find some way to be passionate about it. If that's because they get to pay the bills and that's what makes them happy, whatever. But once all of that is gone, the love, the zest, once that's gone, then, what else is there besides pure existence? And then that starts to feel overrated itself. So, people have to be able to engage, and they have to be able to achieve and enjoy the rewards of doing the right thing. Going to a doctor, getting their problems taken care of, going to work, being able to afford a house and a car without having to sell a kidney. That's the kind of thing that's going to make people less prone to chronic afflictions and bring them closer to remission. When everything else in life is starting to work out normally, then it's probably a lot easier to bring somebody back from something like being exposed to Lyme disease.
And it sounds like if there's some sort of antibiotic combination or some sort of treatment that can actually kill the pathogen that is eating away at our brains and our skin, that would probably help to get to the level of having the joy and the being able to make it to work and not be a wrecking ball.
Sometimes it takes a lot of years. Even with syphilis, it's known that some patients may require months or even years of antibiotic treatment. But if you've got syphilis, they're not going to stop hitting you with antibiotics until they're sure it's gone. And just like with Lyme disease, syphilis creates or converts into a round body form inside the body. It's kind of a what you call it, where they're sleeping for the winter. It's kind of like a hibernation phase. It's a phase where the bacteria is not active. But once those antibiotics persister cells, round bodies,
Oh,
yes sir, L forms.
Okay.
And so once those things are round body forms, once those things are, the antibiotic exposure is gone, they go back to a spiral form. They convert from round body to spiral form. Syphilis, we've known about this since the 1960s. The Russian studies on this are fairly complete, and we are finally acknowledging that here. New research last year showed us that 10 to 20% of syphilis patients, early exposure syphilis patients, that's somebody who wasn't sick before, they had an encounter and then they contracted syphilis, are resistant to treatment, standard penicillin treatment. That happens in 10 to 20% of early exposure syphilis patients. This year, we were able to demonstrate that in vitro, that's in a test tube, syphilis was resistant to penicillin. And we've known about that for, like I said, since the 1960s. But when you have a study in 2025 that's showing that, that's when people need to stop and think, okay, maybe antibiotics isn't the total solution for everybody all the time, like most people in general believe nowadays. That for them, syphilis was something that, went away 100 years ago when penicillin came out. That's not
Well,
exactly.
that's called ignorance.
And a lot of times, willful ignorance, too. I mean, syphilis is one of those topics that it's got the stigma, and that's why people don't want to talk about it. It's a very real situation.
That's their problem.
Yeah, it's a very real situation, but it's hard for people to talk about because it causes feelings of guilt. And with Lyme disease, at least, it's nobody's fault. It was that tick that jumped on you. That's why it's a lot easier, even though the two infections are very similar, that's why it's a lot easier for people to latch on to Lyme disease. Maybe they don't have Lyme disease. Maybe they do have syphilis, but it'd be a lot easier to get
Yeah,
diagnosed.
you make it. That's your point's made. That really does. Why exactly? Why is it all about Lyme, and then we're finding that syphilis is maybe way bigger than, yeah, because it's an uncomfortable subject in general. I can see how that and Morgellons doesn't get, then everybody would think you had syphilis on your body,
Oh,
and
yeah. That reminded me of one time I went to a friend of mine's house to work out on the weight bench, and my skin it was covered with those gumas, those open, oozing, cratered sores. And right after I got up off the bench, man, he came back with a wet towel and the spray. He was hosing it down, make sure it was clean. Right after I got off it. Yeah, nobody needs to be walking around with open, oozing sores all over their body. But
now,
it took seeing a Lyme disease specialist to get that addressed responsibly.
yeah, that's more traumatic than if you haven't had experienced something like that. It would be very difficult to understand the trauma. I think a good way for me to see it, and I know this because I've had psoriatic breakouts and I mean, itching beyond belief. And especially at the times you need it to not itch. And I can say one thing, it's like something that looks like this feels 10 times bigger. Like you said, and you throw in the salt, the feeling of, like you said, the gumma, seeing it, having to wash it off, and that, and self-esteem, and I mean, there's just so much, and it's a distressing feeling, and those things. It's not like you don't feel it. You don't when you have lesions. I haven't had ones like that, but I imagine that, like you said, you couldn't wear certain shirts.
I just didn't feel like buying new clothes. I mean, or even dressing up. It was always gray sweatpants and a t-shirt because, at the end of the day, it was going to be caked and crusted in blood. Uh, yeah, the one thing, Morgellons feels like splinters all over your skin. It feels like splinters. Dr. Ginger Savely allowed me to interview her for my YouTube channel, and she explained that in Mexico they consider Morgellons, they call it cactus man disease. And it really feels like that. It just feels like you got splinters all over your skin. They hurt like hell. You've got those hair follicles that are ballooning up with junk collagen. And so you feel the pressure underneath and you just want to pop that thing out. It's a nightmare scenario, definitely. But it feels like having splinters all
Yeah,
over your skin.
I can imagine people would start to question whether they want to live. To be quite honest, these things are not normal, and that is just it. It it's devastating, especially if it's called, the people who went in, oh, that's delusional parasitosis or something. Um, yeah. So, anyways, I'm just trying to take some of the sugar coating off of it. To me, I can imagine that is absolutely far more um, not even frustrating. There's a better word for it, but this is
It's
an all
discouraging.
encompassing. It takes over a person's life. That it probably was taking over your life, and this was going on and on and on.
Yeah, and you can't just not pick because that shit's gonna keep growing, and it hurts like hell. Um, I did want to, while we have a little bit of time, I wanted to open the floor to see if anybody had any other questions before we continue. I think we have about 7 or 8 people still on here. If you have a question, feel free to drop it in the chat. Dr. Joseph, I appreciate you hosting me here today.
Yeah, no, I was excited to know that you were talking, and then thanks, Shell, for getting them out there. You can take, we need all of the experiences, the learnings, to piece this together and contribute the knowledge that you have um, that you've built up, you've learned. Your journey, your story is extremely impactful, and it, you know, and being an advocate the way that you are, my biggest hope is that this has an impact in what I'm doing. I feel like is we're in sync. We're doing things for a bigger reason. We're taking what I'm hearing from you is you're taking your suffering, pain and suffering, and making for damn sure other people don't have to go through that.
Yeah. Yeah.
And I feel the same too. I always say, look, it there's people out there suffering in silence. I mean, what greater gift to have figured some things out and to be there at the right time for somebody else who is who is just lost and not knowing where to go. Nothing's working, and then boom, you're right there. You've got the answer, and make an impact on that person. And I mean, that's really what it really is all about. And that's where it's always ended up for me. Is why am I doing this? It's to do my part to make the world a better place. Because this is not a nice planet whatsoever.
It's got its moments. I mean, there's some thrilling excitement out there if you get out and about.
Yeah, yeah. That's I probably should go out and have some fun. That would help. So
I will say, yeah, I will say that has been something that's helped me through this. Has been the exercise. I have a group of friends, a small group of friends. We play disc golf every once in a while. Disc golf is huge. Also going to the gym. I'm a Planet Fitness guy. I understand but I like it. It's okay. And they do have a red light machine there, so we can try that out every once in a while. Make sure if you're
yeah.
using any kind of red light machine in a gym to wear socks. Keep your socks on because there's something nasty called plantar's warts, and those hurt like hell. They feel like splinters in your feet.
From the red light? Or
Yeah, from any time you're in a public place, try
oh
not
yeah.
to. Yeah, sandals, whatever you got to do, don't because a lot of
Oh,
people don't
okay.
know you can pick up an
No,
infection.
I've been thinking about that too a lot recently. Is you know walking around barefoot now seems like a liability for yourself because
That's
what?
that's Toxoplasmosis gondii walking around barefoot. That's why the Asian families take their shoes off at the entrance so they don't track that craziness back into the house.
Yeah, exactly. They know what they're doing. um, well, cool. Well, this was fun, and I'm certainly filled with new learnings, and unless anybody else has anything else, I'm good. All right. Well, let's call it.
Good
All
night.
right. Yeah, definitely appreciate everybody making time to participate today. Thank you, Dr. Joseph. Thank you, Dr. Halasa, absolutely, for hosting me here this evening. And I hope to be back sometime soon.
All right. Thanks, guys.